Being an emergency medicine doctor and working in the emergency department means that I hear a lot of medical myths and misconceptions. And one of the main reasons why I made this channel was so that I could better educate people so they can make better decisions regarding their health as well as the health of their loved ones. So I wanted to make a short series debunking some of the most common myths that I hear. If you've ever had a cold, you had a cough and congestion, and you started to develop green phlegm or green sputum, and you went to your primary care doctor's office or even the emergency department because you've been told in the past that you need antibiotics, well, you're not alone. I hear this almost weekly in the ER. Unfortunately, the color of your phlegm or your sputum doesn't indicate whether the infection is caused by a bacteria or by a virus, and doesn't really determine if you need antibiotics at all. So I know a lot of you out there probably still don't agree with me. You might even have heard a different answer about this from other healthcare providers. So who do you really believe? Well, hopefully I can provide a little bit of background information about what's actually going on in your body, which can kind of help you understand the actual truth. When your body develops an infection, your immune system turns on. And when that happens, a bunch of different immune cells rush to the area to try to get rid of whatever's causing the infection, whether that be a virus, a bacteria, a parasite, or even a fungi. So when these cells get there, they release a bunch of different enzymes to try to kill whatever it is. One of those enzymes specifically is called myeloperoxidase. Myeloperoxidase then undergoes a chemical reaction and forms a hypochlorous acid, which essentially is what is being made to try to kill this. With that, myeloperoxidase has a heme molecule which has iron in it, and that iron is actually what gives your phlegm or your sputum the yellowish or greenish tint. So even if you have a viral infection, you can have a significant immune response and your sputum or your phlegm can be significantly green. So just because you have green phlegm, it doesn't necessarily tell you if it's a bacterial infection, if it's a viral infection. You can have the common cold, bronchitis, or you can have bacterial sinusitis. They can all form thick green phlegm. So that alone won't tell you what's actually going on. I also hear often, well, why can't I just have antibiotics? Because if it is a bacterial infection, it'll get rid of it. If it's not, it'll go away on its own. Well, unfortunately, antibiotics don't have a 100% safe profile, meaning that you can have adverse reactions to antibiotics. Some reactions are relatively minimal, such as nausea, diarrhea, but some of them can be pretty significant. They can result in significant burns or rashes called Stevens-Johnson syndrome, and they could also lead you to have other infections from opportunistic parasites such as fungi. So, how do we actually decide who needs antibiotics? Well, when I see a patient, it's really the whole picture that I have to take into account. Some things, such as how long the symptoms have been going on. Symptoms greater than 10 days often can be bacterial in nature because viruses usually kind of get defeated in that period. Or if your symptoms were starting to get better and now they're getting significantly worse again, that can indicate that a bacterial infection has started. Or your vital signs, if you're immunocompromised, other things like that. So it's the entire picture of the patient that kind of tells me if this is probably a bacterial infection or a viral infection and whether or not antibiotics are even needed or not. When I'm at work in the emergency department, I never prescribe antibiotics only based on the phlegm color or the sputum color. It's kind of everything that I described before that determines if I actually prescribe antibiotics for the patient. So the main takeaway from all of this is pretty simple. Your phlegm color doesn't actually tell you if it's a bacterial infection or if it's a viral infection or if you need antibiotics or not. So if you've ever heard that green phlegm or green sputum is caused by a bacterial infection, you're not alone. I hear it probably weekly in the emergency department, and it's continuing to this day. I even hear other healthcare providers propagate this myth at times, which is somewhat sad to hear, but it does happen. So if you hear it again in the future, you can remember this video and hopefully you can teach somebody else. I plan to continue making more videos about medical myths and spreading some more education. So if this is something you're interested, just like and follow.